or holes, erodes lesion. How can bacteria do this? Bacteria produce all sorts of enzymes and toxins and things that can cause ulcerations. And I mean, if you get Naegleria in your brain, it'll turn your brain to liquid. So, bacteria can definitely cause tissue to dissolve. I see little white things in my hair. Is this skin flakes or what is this? It's possible it's skin flakes, but as we looked on, I hope that the talk helped with this. It could be, it could be anything, probably skin flakes. So that was one question. I'm going to pass it on so I don't hog the microphone.
This question is, I have black specks that come out, so does my 15-month-old grandson. How is this, if not contagious? And my thought would be that you probably live in the same area, may have had some similar exposures to potential pathogens, and perhaps share some immune system characteristics. I think that's more likely why you have similar symptoms than it being contagious.
Don't mind. I have also several questions. Maybe I will start with the first one. Can Borrelia be confirmed by giving a blood test? I was given a blood test and I was told by my doctor that I haven't had Borrelia infection. So that might be, so there's no 100% safe testing available. I guess the sensitivity is getting better and better. So it might be that you have Borrelia with having negative testings, but the chance is even not anymore so high as before.
Okay. Over the past year, the majority of my skin lesions have improved. However, I have an ongoing and unrelenting issue with the organisms in my eyes. What can I do? I've always found that the eye symptoms are one of the most bothersome and difficult to deal with. Some of my patients, have actually had eye doctors remove filaments from their eyeballs, so they're in there. I forgot to mention that to Dr. Feldman, as a matter of fact. I was wondering what his answer to that one would have been. But anyway, I have to say that I've tried pretty much everything for this, different types of eye drops and gels, and I unfortunately haven't found anything that really helps that much, other than just continuing to treat the underlying cause with oral antibiotics and all that, and eventually we get there, my patients who've had these severe eye symptoms. But just for symptomatic relief, there really isn't anything. I've found that that's good. I don't know if anybody else on the panel has. Anyone? Bueller?
Please, can you suggest a treatment for Morgellons on the face, especially I'm a treatment of a 15-year sufferer. Thank you. I think that kind of echoes what Dr. Savely said about the treatment of the underlying cause with the appropriate, antimicrobial therapy, if that's antifungal, viral, treatment for Lyme disease and other tick-borne illnesses. I've had success with some of my patients with topical antibiotics like Axone, which is Dapsone topically, Mupirocin topically, but it all is individualized. I've used some homeopathic remedies like Ledum cream or Durcot by Picana, but they also were all done in conjunction with the treatment of the underlying infectious process. So I think, because the face, to a lot of patients, cosmetically is the worst of the symptoms, that both topical and oral treatments can be of benefit, and I've had success with both formal therapies and natural remedies as well.
given that to many people over the years, and
Hit or miss. Yeah. 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 It's old school, yeah. Yeah. It is. It's an antibiotic, metronidazole. Yeah. Mhm.
how were we doing? Oh, wait, Randy.
Actually, this would probably be technically better for one of my colleagues here, but what medical issues are there for couples to have sex? Is kissing on the lips okay? Now, I do not feel that Morgellons is communicable from person to person in any sort of a casual fashion, and so I don't see that as a problem. Now, I have heard that there have been some instances where there might be sexual transmission of Borrelia between partners. But I don't know how strong that link is. I haven't actually read papers on that topic. I've just heard it mentioned. So being somewhat skeptical about things and just thinking of other bacteria, I've not heard of anyone acquiring Morgellons from probably anything other than a tick bite or something along that line. Do you have something you want to add to that?
We don't know all the secondary factors, so, you know, even there's probably, you know, until we determine the secondary factors. I know some couples where one has Lyme and one has Morgellons, and so maybe, you know, even if there's been sexual transmission of Borrelia or other microorganisms, there's likely genetic factors and other things that have to be present in order for there to be Morgellons. And so, you know, you have to remember that Morgellons is a skin condition. It is not the infection. So it's the way your body is responding to a pathogen, and that's very unique to the individual. So go ahead and enjoy your loved ones.
Someone wrote a question, and I think this would be an audience response question. How many here have had severe pain between their shoulder blades? So quite a few. I'm not raising my hand because I haven't had severe pain there, but I have casually spoken with another Morgellons sufferer, and we both happen to get outbreaks of little spots of blood, which we can tell when we get up in the morning, and it's on our bedclothes or sheets or whatever we wore to bed. So for me, that gets back to the white clothing issue. So there does seem to be something about that area for some of us that it can be very sensitive to symptoms.
Next question to me, how does drinking, smoking and drugs affect Morgellons? It's a good question so far. So I guess it was part of my presentation today. There's definitely big impact of your lifestyle habits on your recovery process. And that is published in several studies that smoking and drinking could have negative impact, and I have learned over the past 27 years it's always best to avoid this. Unfortunately, so that's what I'm telling my patient. If possible, stop smoking or smoke less, avoid any alcohol beverages. Dealing with antibiotics means that some of them or most of them are so-called prodrugs. They get their effectiveness first by the liver passage, and if you're going for alcoholic beverages, that could have negative impact, unfortunately. And it's similar to the use of drugs. I have some patients who need drugs, due to very severe pain syndromes. So then from time to time you have to think about what is best for the patient. But I mentioned today that severe pain syndromes could lead to tremendous stress, which also lead to big deficits in immunofunction. So sometimes you have to go for both, and if you choose for the middle, each of them, so less from all of these toxin, it will have much better influence to your chronic infections. And maybe I can answer another question. Have you had any patient who have made a complete recovery, no more fibers? I guess I had some. Yeah. The problem is that we do not have any really long-term observation. It would be really great to meet patients again after 5 years, after 10 years. But I'm only 10 years in the field now, and I hope I will see some more patients, and maybe we will be able somewhere to make these long-term follow-ups observations to get really a better answer for this question. But I guess there's always a chance of recovery, and maybe one thing I want to point out is, as early as you start treatment, as better your chances are to get improvement or full improvement later on.
I just wanted to add to that. I've had quite a few patients become totally fiber-free and stay that way as long as at least 5 or 6 years that I know of. Who knows what's going to happen down the road. But probably, I have to admit, the majority still have a few symptoms, but they're so much improved that they're perfectly happy to live with the way things are. But it's just exactly what Dr. Nicholas said, that the ones that have not been sick as long, those tend to become the ones that are totally asymptomatic, no more fibers. The ones that have been sick for 20, 30 years, I don't think I've ever had one where they became 100% asymptomatic, but they got quite close and they were happy with that. A question I had here, I'm not sure where this patient may have heard this, but they're saying that it's been mentioned by some that iron may help feed the disease. Now, I don't know if you mean iron may help feed Morgellons disease, or you mean Lyme disease. Iron does not feed Lyme disease. I don't think it feeds Morgellons disease. I don't know. Manganese has been said to feed the Borrelia spirochete, but not iron. And so I don't really know of any relationship with iron and Morgellons disease. I'm not sure where the person heard that, but anyway.
And I guess to echo what you guys said, it is important to know that, the patients who do the best are those who make necessary, they're compliant with therapy, and also stay in remission, being compliant with the lifestyle and, modifications that are recommended by their provider. Because that's the one thing that I see with my patients who get into remission, and those that stay there tend to adhere to some sort of maintenance strategy. My patients who get into remission and then go out there and they go binging and partying because you're feeling good and you're getting your life back, those are the patients who tend to sometimes have that relapse. So I always tell patients it requires you to have patience, but also at least do some type of maintenance strategy in order to have long-term remission. Because unfortunately with tick-borne illness, at this point there's no complete cure. But the goal is definitely remission, and you can have remission from both Morgellons and of Lyme disease, which would lead to remission of your Morgellons. So my question is, what is the best for breaking up biofilm? Stevia, xylitol with lactoferrin, and other supplements, meds. And this was something that I mentioned a little earlier. Eva Shoppy's work looked at stevia, and then there was a paper published on the combination of lactoferrin and xylitol in the treatment of the biofilm form of Pseudomonas. And I've had clinical anecdotal data in my practice that shows that is very helpful for not only treating the biofilm form of Borrelia, but I've had some patients have significant herxing with Candida. because lactoferrin has an enzyme, lactoferrampin, that also helps improve the effectiveness of antifungal medication. And there's literature coming out showing that Candida is also able to morph into biofilm form. There are also fibrinolytics and proteinolytics, lumbrikinase, serrapeptase, nattokinase, which can be used synergistically in some to treat biofilm. And there are other herbals. I know one product, BFM, MCBFM1, by Beyond Balance, that I've used to treat the biofilm form of Borrelia in some patients. Do you have any?
May I add something else regarding biofilm? So I missed one substance, which is, from my perspective, also one of the best in getting this task, killing biofilms, and that is the N-acetylcysteine, NAC. It's, I don't know how expensive it is here in US. So it's the most cheapest medication in Europe. 3 months treatment is around $20 US. Yeah. N-acetylcysteine, NAC. Yeah. And this substance is killing biofilm best. That had been approved by several studies. It's cheap. It's always available. And there's another big advantage. So you can use this stuff, especially in patients, to clean the liver as well. So it's one of the best detoxifiers. And if somebody has problems with raised liver enzymes, NAC is a best support even in these cases. So from my perspective, it's cheap, it's very successful to use and useful.
I have to read this one verbatim because I have to correct something. If the fibers were found to be DNA of collagen and keratin, have the samples been tested to match the DNA of the person they were extracted from? The fibers are not DNA of collagen or keratin. The fibers that were talked about here, as far as their composition, are collagen and keratin. Those are proteins. So in your genome, you have DNA that codes to make the RNA that then is used to actually synthesize the proteins. There's no DNA associated with it. Now, anything that comes out of a body or an animal or an insect drags some cell debris, some DNA, RNA along with it, and so you could probably find that. But the fibers are not DNA.
Okay.
I have seen a small white thing or black thing coming out of my hair follicle. Do I have something else? And I feel I have dry powder on my eyebrows and eyelashes. Is that a fungus? What is this? You know, it's hard to know exactly what something is chemically without doing a chemical analysis. I can only guess, and I don't have the specimen, but you know, if something's coming out of your skin or your follicle, is likely a fiber, so it's likely keratin or collagen. And then the powder on eyelashes is very unlikely that that is a fungus. Now, skin and hair and nails are infected by fungi, and we call those dermatophytes. But, you know, dermatophytes are easily studied, and, you know, some hair can get infected with it, and so you would be able to see spores within the hair, and I'd have to look at the thing, but I think it's very unlikely.
I'd like to expand on one of the questions that Dr. Savely was addressing, her last question, which is the question of, are you ever completely cured of something chronic? And it may be that a person can stop producing fibers, but the fact that you may still be producing them doesn't necessarily mean that you aren't getting better or in the process of getting better. Remember that when Sir Thomas Browne described the children hundreds of years ago, he said when the black hairs came out of their backs, he knew that they were getting better. So it may be that for some of us, like me, who probably has had this for over 40 years, there may be a process of just kicking out the debris of so many years before I got treatment. At ILADS conferences, when Drs. Horowitz and Burrascano are really pushed, does anybody completely recover from Lyme? They tend to say they can't give a definite answer. But we do know from recent research that the immune system, the body, always stores our old pathogens in biofilm. And I don't know whether that's a library for the immune system or what's happening. But to say that a bacteria or parasite is completely eradicated may be an unrealistic expectation, and I encourage you not to worry, because I think the body has reasons for what it's doing, and feeling a whole lot better or stopping producing fibers, as Dr. Savely said, if it's an infection caught early on, it's a good sign. If you're feeling better, is the best sign. So
I think we're out of time at this point. It's 5 o'clock, which means we need to end the conference. I did want to, it's come to my attention that there was someone giving out handouts, and I just need to announce that those were not authorized by the Charles E. Holman Foundation. Some pretty odd handouts were going around about you have sinned against God and this and that is absolutely not true. We're going to go ahead and close the conference, but we're going to have a sign-making party in the back 2 rows to make signs for the rally tomorrow. And so we hope that some of you will stay and make signs, and if you leave, you can always come back. The sign-making party will be going on in the few rows in the back. And I want to thank everyone